Assalamu alaikum. Dear viewers, welcome to RAHENUMA Academy talk show. Today we have a special guest, well-known and renowned physician and surgeon, one of the best child specialists from MAMTA Hospital, Jalgaon. And he is none other than Dr. MAJID Khan. Most welcome.
Thank
from
you.
RAHENUMA Academy.
Thank you very much.
Myself, I'm a RAHENUMA Rafiq Khan, and I would like to take interview you.
Okay, ma'am.
So, sir, my first question is, can you please introduce yourself and with us and about your professional life to our audience?
Definitely. Myself, Dr. Majid Khan. I am a neonatologist and a pediatrician. I am practicing since last 16 years in Jalgaon. I am a director of MAMTA Children Hospital, Mehrun, Jalgaon.
Okay, sir. Sir, what inspired you to become a doctor?
Basically, being doctors, what is the best thing is that you can bring smile on the faces of a sick person. That is the most happiest and satisfactory thing for me. That actually inspired me to become a doctor.
Nice, sir. Sir, what do you consider to be the most important qualities for a doctor to possess?
See, whenever patient come to us, he is already stressed. He is in a panic situation. So, being doctor, you have to treat patient as well as their relatives or their parents. So, I think the most important thing is to satisfy the family with your knowledge, and you should counsel them and make them comfortable when till the time they are in the hospital. So, I think that is the most important thing. Patient should get cured, as well as the relatives and the family, they also should be comfortable and they should be confident on your treatment. That's what I think is the most important thing.
Okay, sir. Sir, my next question is, how do you approach critical patient cases?
Critical patient, see, in medical fraternity, the most important thing is history. We have to work like a CID. Like a CID catches a thief, we have to, in the same manner, we have to diagnose a patient of a particular disease. So, whenever there is emergency, first of all, we stabilize the patient and we'll try to ask multiple questions by the parents or the relatives, so that we can come to a certain clues. We cannot give 100 tests for a particular patient. You have to ask the proper history that guides us for a particular diseases, and then we investigate and come to the final conclusion, or that is what we call final diagnosis.
Okay, sir. Sir, how do you stay up to date with the latest medical research and
Very good question.
advancement?
Very good question. See, nowadays, Google University and WhatsApp University, it is very important, and the disease patterns are changing. You must have seen, especially after the Corona period, the new viruses are coming, very new diseases are coming. Especially being a pediatrician, I am facing a lot of new things. As the now I call children as a big adult or small adult. Sorry, because all other things, stress, hypertension, sugar problem, now I am seeing in children because of the quality of life they are having. So I usually, personally, I attend twice a week online lectures. The medical fraternity, I am lucky to be enough to be associated with good teachers or good academic people. They keep on teaching us. So I usually attend the online classes. I read the article. I have subscribed so many journals. Whenever I get times, I love to study or read some article. So I have kept 1 hour in a day for reading. So I usually I read up for 1 hour and try to cover up the new things. This is what is my schedule: online classes plus journals plus articles, and I love to teach the students. So the best thing about teacher is that the most benefited person during the teaching is the teacher, because he has to read a lot. To take a lecture of 1 hour, he has to read 10 hours so that he can prepare the slide. So these 2-3 things I purposefully do to keep myself updated.
Very nice, sir. Your thought is very nice.
Thank you.
So, sir, my next question: uh, How do you, how will you manage your priorities with your patient, towards your patient, and when you have over more load work?
See, workload is always there, and it should be. We should not feel like it's a workload. God has chosen us in a special field. So, priorities wise, first of all, personal health. I start a day with, I give 1 hour for myself, for my own health. Then your profession come, then family, all things are together. But first of all, if any emergency come, then we, being a doctor, you have to attend the first the patient, then my own health, then my family health. So according to that, my I usually decides my timetable according to the situation.
Okay, sir. So, sir, can you describe any incident when you had make a difficult medical conditions?
See, being doctor daily, the day to day, any day can be a challenging day. You can, if you are having bad day, anything can happen to you. But so many things happens with us. But the best thing is that whenever any critical patient get cured and we see him smiling, that that washes our throughout day's stress. So that is the best thing. If we can save someone's life, that already, that is the biggest satisfaction for us, for being a
Well done,
doctor.
sir. Well done. So, sir, how do you communicate? How do you communicate with your patient and their families and about their medical conditions? Medical conditions.
See, basically, it's a basic right of any relative or any patient to know about on their disease. I usually tries to explain them about the disease, the prognosis, the duration in a simple language which they can understand, or by giving examples of their profession. So I usually ask about their profession, about their history. I give much more timing in counseling, because that is the very important part. If they are counseled properly, I think they will cooperate you. First of all, they should have trust. Basic thing is trust. Medicine, writing medicine and giving, that is not, if you, unless and until you will talk to them in their language, how will they have faith? Because they are giving their jigar ka tukda to us. Being a pediatrician, they are giving their jigar ka tukda. So they should have a faith that Dr. Majid can take care of my child. So I usually give 5-10 minutes more in counseling, because writing on a paper is a different thing. If they don't give drug at home, how will my drug will affect? Okay, so I explain them in a like mother, father, and dadi, dada there, and so I try to explain them in their language, so that become easy, and they understand that this doctor is हमारा doctor और घर का doctor जिसको बोलते हैं. ठीक
Okay,
है.
sir. Sir, how do you ensure patient and confidentiality and privacy?
See, insurance, I usually tell them, see, करने वाला ऊपर वाला है. I am just, I may be जरिया of anything. So first of all, you have to, we cannot, being Muslim, we cannot tell them 100% I will only do the thing. This all we are agree, I think. But I usually try to tell them, if you tell them the duration, the complication, the way, the process of disease, I think they have faith in you. If some pneumonia patient comes, I usually tell them that this will take, first of all, the cough will increase, fever will be there, all things will happen, then gradually it will start decreasing. It will not happen that I will give one magical injection and patient will start getting up and no fever will be there. So you have to explain them the in a duration wise, and confidentiality. You have to talk parents, most of the time. You have to talk to the parents rather than other people. Some diseases are there that they have to take care, special care at home after, even after discharging. So that I usually, as I told you, I give more time in counseling, because that is the important part.
Okay, sir.
Okay.
Okay, sir. What is your long-term career goals as a doctor?
See, society has given me a lot of respect, a lot of wealth, I can say. So my aim is to create more good doctors. Okay, if my experience can help them to achieve a good medical practice. Being a doctor, I have achieved last 16 years. Jalgaon has given me a lot of love and respect. So I have to treat the patient also, and I would like to create more doctors like me, so that they can help our community in medical health and medical profession.
Okay, sir. How do you balance ethical and financial consideration for the patient cases?
See, we have to work. We have to be. Doctor should be very flexible. You should not. He should not be money minded. So according to the patient, I am very flexible. I usually tell the patient that you don't worry. First of all, save patient's life. Then we'll see. And then they also understand the things and all the thing. So patients economical condition by seeing doctor have to be very flexible in that. Money should be the second priority. First of all, life is very precious. So first of all, we try to save the child, and then we take all the other things.
Nice, sir. Sir, how do you address cultural or a language barrier with patient?
Cultural language barriers, Alhamdulillah, I have equal patient. I have non-Muslim patients also. I have Muslim patients also. So as I told you, doctor should be multifaceted person. He should have so many qualities. When I came, I didn't know how to talk in Marathi, but I learned purposefully with my non-Muslims doctors, and I try to come on that. And as I speak more Marathi, I got improved. So now many people, they are happy with my Marathi only, and I tells my students also that you should be like an actor. Like for a particular thing, you should be a good dancer, you should be a good actor, then you should have your health also. So doctors are like multifaceted, because if you talk in their own language, they are more comfortable. So patients come to you, he should feel that I am their family person. So you have, that quality you have to develop while practicing also. Whenever there is a Muslim patient come, I try to talk in their language, so they are more comfortable. So that you have to develop that thing in you.
Very nice, sir, and great. Your thought is very good.
Thank you,
And
thank you.
sir, at the end of the program, would you like to give some message to our audience?
Audience, see, education is the only weapon by which we can conquer and we can stay alive. I would request all of you, parents as well as the students, focus on your studies. There are so many dilemmas, so many fluctuations are there, like TV, mobiles, your WhatsApp. Then you should have you should have decided your goal. You should have your own timetable, respect your teacher, and trust God and work hard. Inshallah, no one can stop you being a successful person. That's what I want to say. Very nice initiative, sir. I am from Urdu medium. I am very proud to be a Urdu medium student. When I got admitted in first year MBBS, I only know what problems I have faced. First of all, that I went into depression. For 6 months, I couldn't understood what is going on while lecture. But then our teacher, my parents, my teachers, they taught us only one thing: never say die attitude. You have to fight. You can't cry. Try, but don't cry. So I learned. I start reading. Then I contacted one of my professor. He advised me, you start reading newspaper, you start listening radio, at that time radio, and you be with the person who speaks in English. So I joined a friend circle, and that is advice what I will give. If you want to learn something, join a group of people who are expert in that. So that is a good thing about this. Then I just started learning, listening what they are communicating. Then gradually I started speaking in English, and then my English vocabulary and all improved. I haven't attended any single class of English speaking, but you people are lucky to have sir and guidance. At our time, we don't have proper guidance. So English, I think you should have command on English as being international language. You should have command on Marathi also as being regional language, and you should be bold, because nowadays it's a time to debate. But we should have more person to debate in every language. So it's a very good concept. Be speaking English gives you a lot of confidence, and that will definitely ensure the bright future of your student. I am very happy and very thankful to you all for calling me here, and all the best to RAHENUMA Institute.
Sir, I am very grateful to you for coming to
Thank you, thank you.
program and talking your valuable time to audience with your good thoughts.
Thank you,
you
thank
very
you very much.
much.
Thank you very much.